We have at Greenville Hospital System a robotic Hanson robot for ablation of atrial fibrillation. And that's a fairly new technique, and we do more of those than anybody in the state, and probably second the most in the Southeast. And those are for people with atrial fibrillation, although everybody with atrial fibrillation does not qualify for it. But I would recommend that if you have atrial fibrillation, you at least look into it to see if you're a candidate for that or not. Atrial fibrillation is an abnormal heart rhythm caused by a dysfunction in the upper chambers of the heart. It can be fast, it can be slow, it can be normal rate, but nevertheless it needs to be addressed because those patients usually need to be on some kind of medication, particularly blood thinners. The other procedure that has come up in the last few years that I think is extremely important are biventricular pacemakers. And those are particularly good in someone whose heart is functioning at a low level. And the biventricular pacemakers are placed just like any other pacemaker, except that they have two leads. And they help the efficiency of the pumping power of the heart. It's a treatment for chronic heart failure, for the most part. Now, if you have to have an AV node ablation because of atrial fibrillation or because of some other reason, then you need to have two wires of the biventricular pacer with two wires to make the heart function normally.